And first, what are bad fats?
Yeah. Bad fats are like the saturated fats. Crispy pata.
Okay.
Okay.
Sarap naman nun. Paano yan? Gusto ko nun. Okay. Paborito ko lechon kawali.
Lechon kawali.
That's bad.
Oh yeah, the fat in the lechon kawali, and then the oil, of course. It's bathing in oil, right? When we cook it, yeah. So those are the bad
Swan.
fats.
Oo.
Yeah. Sugar.
Pati asukal. You can get metabolic-associated fatty liver disease from sugar.
Yeah, because sugar pushes you to have diabetes, right? And that's also part of the metabolic constellation that they both mentioned earlier. So that's also like a risk.
So, Dr. Sollano, maybe you can take that first, is people in the room might be asking, wait a second, my sugar is high enough as it is, may problema pa ako, pwede ako magka-fatty liver, ang dami ko naman problema, di ba? Because when they go to the doctor will say, hey, your sugar's borderline, ha? Hindi pa diabetic, but borderline. So, Doc, how is that related? People are thinking, why is it my sugar's high? How is that related to my fatty liver? If fatty na ang term.
Good question, Karen. In fact, when you study biochemistry in medical school, we know that part of the carbohydrate that's digested in the liver basically turns into cholesterol. So there's a link between carbohydrates and fat. And that is why when you just become obese or you become a diabetic or with just a condition of high blood sugar, eventually that can turn into some lively droplets that invade your liver cells.
Kanina pinag-usapan natin yung re-education, di ba? I think ang word talaga is education. Yung mga batang maliliit pa lang sa eskwela, sana part ng curriculum nila yung proper way of eating. Of course, nandun na medyo mahirap nga tayo maka-access sa mga tamang pagkain na hindi nakakataba. Pero kung susubukan natin sila ma-educate na yung gulay pala, yung konting pagkain lang na mataba ang pwede naman kainin lang, less ang kanin sa kanilang kinakain, sana nag-exercise sila at madami silang activities na hindi lang sila sa cellphone. Palagay ko yun ang klaseng education natin na kailangan sa primary part pa lang na kanilang mabuhay at nangyayari ito sa eskwelahan. Makakatulong talagang malaki yun. And then siguro nga kasunod dun yung pag-educate natin sa mga parents nila. Kasi pag matama ang pagpapalaki ng ang information na nakarating sa mga parents nila, maibababa din nila yun sa kanilang pagpapalaki ng mga anak nila.
Yeah, so yung sinabi ko kanina, give liver a voice, ano? Kasi 'di ba, silent talaga siya. 'Di ba sinabi nga namin, especially at the early stage, wala. Pag may naramdaman ka na, complicated na yon. Yun na yung fibrosis, cirrhosis, pangit na yung liver. That's why our campaign really is to educate. So we're partnering with the Hepatology Society of the Philippines, even the Philippine Society of Gastroenterology. So not just on doctor education, but also patient education and consumer education. In fact, even with the pharmacists, kasi di ba, pharmacists are also frontliners. So that's why we're also partnering with them. Kasi especially patients, we see them pagka pupunta sa botika, di ba? Nagtatanong eh. So we're also educating the pharmacists in terms of fatty liver, the complications, how to manage, diagnose, etc. So yun yung talagang campaign namin. Right now really, as you have seen, education, awareness is very important. That's why we're really looking at ways on how to educate. At sabi mo nga, di ba, hanggang yung laylayan, di ba?
Yeah. So of course, hindi lang ito yung start ng inyong campaign. Of course, there will be more campaigns later on. So ano po yung mga gagawin niyo pang campaigns to really put fatty liver into the spotlight, lalo na nga sa mga mahirap na mga kababayan?
So aside from the education and awareness programs, no, so yun nga, we're also partnering with some stakeholders, even at a global level. Kasi nga, yun yung policy shaping, yung importante rin, di ba yan? So, and then also the other relevant stakeholders. So, yun. So, and then also, once we educate and then increase awareness, kasi di ba, when we reach to these patients, we also get to know ano pa ba yung data gaps, ano pa ba yung kailangan nila. So, maybe from there, we can also like determine further campaigns, that the ones that are needed talaga.
nasa lang po doon, ano na lang po siguro ang inyong message kasi I mean, many Filipinos are not aware na of fatty liver disease. Parang hindi pa nga nila alam na baka meron na sila nito. So,
Yes.
ano po yung message na lang po sa mga Filipino na, of course, not aware pa sa fatty liver disease and how are they going to be more aware?
Okay. So, dapat talaga, with your help also, anuhin natin na there is this thing as fatty liver. Okay? At saka, hindi ka uminom ng alcohol or ng alcoholic beverages, hindi ka magkakaroon ng fatty liver because there's non-alcoholic, there's alcoholic fatty liver disease. And then there are also a lot of risk factors. So diet, di ba? Kung pangit ang diet mo, pwede ka magkaroon ng fatty liver. And then kung sedentary living, yung hindi maganda physical activities mo, pwede rin. And then, yun nga, yung too much sugar, too much fats, even the mere diagnosis of diabetes, hypertension, obesity, pwede ka magkaroon ng fatty liver. So I think the awareness talaga, sabihin natin sa kanila para malaman nila, ay, there's this disease pala. And then, yun nga, again, all those things will follow.